And now to the third of the three great pillars in American capitalism. All right, Gary.
The open market.
Yes, the open competitive market, where anyone can offer his wares for sale at whatever price he can get, is a benefit not only to business and industry, but to the individual as well. The consumer or buyer gains when we have this constant competition in the marketplace. The best products at the lowest cost emerge.
There's this widespread belief that comes from the economics profession that markets will just be wonderful by themselves. And there are good things about markets. You know, I have a pair of slippers here that comes from a market. I bought them from a company that has an incentive to make a good product so that they can sell to me and make a profit for themselves. And I went looking for a good pair of slippers, and I was happy to choose the color that I wanted, and I got what I wanted, they got what they wanted. They have an incentive because of markets to figure out what I want and give it to me. That's great. You know, and markets really sometimes do work, especially for things that don't matter much. It doesn't really matter that much to the world, the quality of my slipper and the color. I'm glad to have what I want. But when you get to things that really matter, you have to be very careful, because market participants can profit from bad things. In the healthcare industry, health insurers profit by restricting your access and by driving you away.
We pretend that healthcare is a market commodity, like buying apples and oranges or anything else, whereas healthcare is actually a complex system that doesn't fit into the market framework the same way as trading apples and oranges does.
Healthcare is not a right, it is a good, like food, like shelter, and like clothing.
What if you had grocery insurance? I'll just buy everything.
Trying to fit the square peg of healthcare into the round hole of a market system doesn't work very well, and America's healthcare system isn't working right now.
We spend more on healthcare, and we get less health benefits than just about any other rich country in the world.
America has the greatest health care in the world.
About 45 million Americans don't have insurance. Another 25 million have insurance that is really inadequate in case you actually get sick. 45 countries in the world have longer life expectancy than people in the United States, including Cuba, including all the Europeans. And yet we're spending way more.
So we spend about 17% of all GDP. That means 17 cents of every dollar in this country is spent on healthcare, whereas these other countries spend about 8 cents per dollar. So it's not like this is a marginal difference. That's a lot of money. We're talking about trillions of dollars. Now, where is that money going? Well, the money is essentially going to private health insurance companies, private pharmaceutical companies. They are not about to give up that money.
15 to 20% of what you pay to a health insurance company goes to administrative expense, including profits. By contrast, Medicare has administrative overhead of about 2%. Why does the insurance industry run up such high billing and insurance costs? It's because the basic goal of the insurance industry is to get rid of expensive people.
Insurance companies make billions of dollars by deliberately delaying, denying, and disputing legitimate claims.
The insurance industry is very successful, not at providing health care. That's not its goal, but at making profits. And the way you make profits in insurance is by getting rid of the people who are going to need a lot of health care. Discourage them from carrying insurance with you. Get them to go away. Not necessarily to die, although that would work. You do this by putting up lots of barriers to access, requiring lots of reviews and lots of paperwork, etc. And after a while, people just give up.
In order to fix our economic crisis and rebuild our middle class, we need to fix our healthcare system too.
It ain't going to save us money. It's going to raise our taxes.
This 2,700-page bill will bankrupt our country. common sense approach that maintains the private insurance system but makes it work for everybody.
I'm concerned about all sorts of things that are in this government takeover of healthcare in our country.
Now, Obama's health care is, I think, an improvement over what we had because there is going to be more coverage and it is going to be subsidized.
Hey, has anybody noticed this crazy thing that we're on the road to socialism? I'm just saying.
A lot of the subsidy gets shipped right back to the same pharmaceutical companies and insurance companies. That's the only way they could get it passed because those people have so much power.
This has been an enormous win for the healthcare industry. That is an unquestioned fact.
The administration chose to nibble around the edges and do incremental stuff where it could, and leave for the future, dealing with the big problem.
You have a diagnosis, doctor? Sales manager syndrome. Bad.
The President's law will not control healthcare costs. We will continue to pay hundreds of billions of dollars more than we need to. If we're going to deal with these problems, we're going to have to make the next step.
The question is, are these troublesome situations really incurable? Or could you cure them if you pinpointed them, diagnosed them, and then prescribed and followed through with treatment?
Well, the solution to healthcare, like a lot of things, if you strip away the politics and greed, the solution is so simple. The solution, it's almost a cliche. The solution is for the U.S. to have a healthcare system that more or less looks like the rest of the industrialized countries. And Canadian, Britain, France, Sweden, Germany, these countries, as a share of GDP, spend half of what we do.
What we really need is a much more efficient kind of health insurance, and that's a national health insurance. You spread the risk among the whole society, and you lower the costs for everybody.
What they're advancing is simply going to give the government more control over decisions that ought to be made between patients and doctors and families.
It's not a government-controlled healthcare system because the healthcare system itself is still controlled by a whole variety of institutions, doctors and hospitals and so forth. But it is a government-run insurance system, and that is efficient. And any economist who's telling the truth will tell you that that's the most efficient way to run an insurance scheme.
It doesn't reduce health care at all. It just means that fewer dollars are going to pushing paper, advertising, and all those other expenses in the health insurance system. Such a system, I estimate reasonably, I think, would save on the order of $500 to $600 billion a year in administrative expenses. That would provide resources for extending coverage to everybody while still reducing what people are paying for health care now. We'd get a better system, fairer system, more equitable system at lower cost.
9 million children in this country do not have health insurance. One study says an uninsured child is twice as likely to die when hospitalized.
There's this unseemly debate among some economists over how many people die each year because of lack of health insurance. A conservative number would be 25,000. Some people say, oh no, it's only 18,000, as if that's better. There is something absolutely wrong about a system where people die because they can't afford the type of health care that, as a country, we can provide them. Now, these Americans who are without health insurance, they are not bad people who should be punished. They're mostly working people. They just don't earn enough or have good enough jobs to have health insurance. And for that, they don't get to go to the doctor. We are a rich country, and that's what we offer people. Working people, hard-working people with children, we offer that to their children because as a society, we're letting the for-profit motives of insurance companies drive the type of health care. From my way of looking at things, from my morality, that is fundamentally wrong. Other people may have a different morality that says it's okay to let people die when you can do something about it. But I think it's wrong.